All so much for joining us for our info session today for Project ECHO focused on value-based care. My name is Sujina Perajuli. I am the lead program specialist for our Integrated Healthcare Initiative program here at Mental Health America of Greater Houston. So before we get started, I just want to start with our mission and vision. At Mental Health America, our mission is to drive community solutions to promote mental health for all. We do this by utilizing education, advocacy, and collaboration to help support system change through a collective impact. And our purpose at Integrated Healthcare Initiative is to create partnership, provide leadership and vision, advocate and educate, and provide technical assistance needed to implement and sustain integrated care. And our vision is the care that is accessible, it's cost effective, and it is the standard delivery of care for all. So with that, let's get started. Our learning objectives for today will be to understand the key components of the Project ECHO series, understand the key components of value-based care, also identify the topics for this series that we put together, and some presenters that we've also confirmed for this series. So just to give you a little background on Project ECHO, this model was founded by Dr. Sanjeev Arora in New Mexico to ensure that the right knowledge existed at the right time and at the right place. So it's an all teach, all learn platform, which really started out as the infrastructure for knowledge sharing in rural and underserved communities around the world. But over time, ECHO has been used in many different sectors and has truly become a platform that connects a group of community providers with specialists at Center of Excellence in regular real-time, having collaborative sessions using Zoom to connect with people all over the world. So through this platform, experts and participants are able to connect and learn from one another through their shared experience and gain access to critical and life-saving knowledge, receive mentorship and ongoing support to make a difference in their community. So this Project ECHO series will focus on the value-based care. We are set to launch this series next month. We truly hope that this ECHO series can help you make adjustments, help you learn from one another, and hear about some challenges and successes that others have gone through. But more importantly, we hope that this platform can help you gain knowledge and gain resources that you need to move forward with your value-based care expansion. So the ECHO format, it's going to be, the first thing is that the subject matter expert will do a didactic presentation, 20 minutes presentation focusing on the subject area, and they're going to share their knowledge and understanding on the topic. And then the rest of the time is dedicated for the case consultation, questions and answers, and conversations. And that's really where the people have found our ECHO series to be really enriching and a really great learning experience for the work that they're doing in value-based care. Here are our leads. This ECHO series was put together by Kara Hill. She is the director of our program, Integrated Healthcare Initiative at Mental Health America of Greater Houston. Ken Yanda, who is the managing principal of Wild Blue Health Solutions, and Dr. Daniel Crow, who is the senior consultant at Wild Blue Health Solutions. And next, I'm going to pass it over to Dr. Crow to talk about the value-based care a little bit more.
Good morning, everybody. So glad you could be here. Thank you for joining us for this informational session. I'm Dan Crow, and I am an internal medicine physician with about 30 years of clinical experience. And I have served in the safety net ecosystem for many years as both a FQHC National Health Service Corps scholar and as the chief medical officer for a federally qualified health center in Austin, Texas. I also have more than 7 years experience in Medicaid managed care, where I was senior medical director for the largest Medicaid managed care organization in Texas. I'm also involved with public health. I'm the chair of the Texas Health Institute, which is the Public Health Institute for Texas, and I'm in the steering committee for this Texas Primary Care Consortium. So a lot of my work has been around value-based care. And what we have here is an illustration of what is value-based care. At the center, value-based care is team-based care that is focusing on the whole person. And there is at the very core part of it is that it's integrated behavioral health. There are two versions of integrated behavioral health that are primarily used in this setting. One is the primary care behavioral health system, where one has a primary care provider who has a primary care a behavioral health provider also within the practice, and that person can be called upon to provide care as needed in an acute setting and more on an ongoing setting. And they can then have this team-based care where they also have care management, care coordination, and the care that is being provided is reviewed on an ongoing basis in making sure that everything is being cared for in that setting. In the collaborative care management model, the primary care provider has a behavioral health care coordinator that is part of their team, who is regularly going over the entire list of patients that are within the practice, and they are reviewing to see if people are staying on their medications, taking or going to their specialty referrals, and doing all the parts that are regularly part of care management. The list is called a registry, which is the people that are under that person's care. And on a regular basis, usually on a weekly basis, there is a psychiatric consultant that participates in a conversation about the people that are being cared for that have behavioral health issues, and ensure that they get the proper care and adjustments in their medications and therapy. There's a quality aspect of this where actually there are measures that are determining whether people are getting better, whether they are adhering to their medication regimen, whether they are staying out of the emergency room or being cared for well enough not to need hospital admission. There's also higher reimbursement. So there's this idea that by going to value-based care, one is getting a provider is getting higher regular income, and we'll go over that in a few minutes. And then is the system and data interoperability, so that there are performance measures that are regularly being monitored and determining whether or not the care that is provided is improving the population health in general and reducing the cost per capita for the individuals that are participating in that practice. If we can go out to the next slide. So this is a complicated slide, but what I'd like to do is have you think about this as going from left to right, where under category 1, we've got the traditional fee-for-service system, where one sees an individual in one's practice, one submits a claim with codes on it that show what was done during that visit, and one gets reimbursed for moving that widget down the line. In the category 4 on the right, it's an entirely different scenario for reimbursement. Under this setting, the number of individuals that are being cared for in a practice, for instance, in a primary care practice, there may be 2,500 or so people that are under one provider's care. On a per member per month basis, there is reimbursement for caring for those people. So for instance, if there are 2,500 people in a practice, the health plan covering those individuals will be reimbursing, you know, an amount per month. It could be something like $15, $30 per month to care for those individuals. And the provider is responsible for the total cost of care for that individual they're caring for. This leads to what's called a population health basis for these payments. And we're going to get into specifics about this and how one can move from the current fee-for-service model, which is still the majority of how care is provided in the United States, to a value-based model where you can have a guaranteed income. And then if things get better for those individuals, or if they stay healthy, there are bonus incentives that are paid so that you actually get paid for doing good care. That is the essence of what is value-based care. And over the course of this year of this learning community for value-based care, you will be learning more about what the journey is to go from the left to the right in this whole new approach to paying for care. Indeed, this has been at least about a 20-year journey that the healthcare system has been trying to focus on, but the approach still has many opportunities for providers and healthcare systems to move into value-based care. It's been a slow uptake, and that's why we are here to help those who have been stuck in the category 1, category 2 area to move into those higher categories where there is more opportunity to improve the quality of care, the outcomes, and get higher reimbursement. If we could go to the next slide. And obviously this is showing that as one goes on this journey, there's higher reimbursement, as we talked about, and a guaranteed income. That's something that really came to the forefront during the pandemic, is that primary care providers struggled to keep their practices financially stable during the pandemic, because they had, if you were based on a fee-for-service system, you had a significant reduction in income. But if you were on a value-based care system of reimbursement, where you were guaranteed a monthly income based on the number of people you were caring for, and you were managing those people during that time, you could have a sustained, reliable income for that time, and that's the whole system for value-based care, whether we're in a pandemic or not. So this is showing the value presented by value-based care. It's whole person care, and it's been shown that there's a 38% increase in consumer engagement, a 16% decrease in use of healthcare services, significantly for treatment of substance use disorder. There's 148% more success in addiction treatments, 74% reduction in symptoms of major depression, 23% increase in primary care services, 80% decrease in cost of care, and a 30% reduction in hospital readmissions. In any given year, there are about 34 million Americans with comorbid mental and medical conditions. Coordinating that care can improve clinical outcomes, increase care quality, while reducing cost and boosting consumer satisfaction. Next slide. So I'm going to turn it over to Kara.
Thank you, Dr. Crow, and thank you, Sujina, for kicking us off. So I'm going to make you do something. I'm going to make you open up your chat box. So I'm going to give you like 5 seconds to open up your chat box. And I want to start talking about why now. Why are we doing this Project Echo now? And to help me answer this question, I want you to put a number in the chat box of how many value-based contracting trainings, info sessions, things like that have you attended in the last 2 years? 1, 2, 5. Good. 0 showed a roadmap. Yeah, 1. Okay, so based off of those things that you attended, I want you to put low, actually 0, low, medium, or high, the amount of change that you were able to implement in your practice based off of what you learned from those sessions. 0. Yeah. Change is hard, right? It is extremely difficult. It's difficult for us as individuals, it's difficult for our patients, and certainly it's difficult for the healthcare system. So I have been at Mental Health America for almost 4 years, overseeing our integrated healthcare initiative. And it started well over 10 years ago. And from the beginning, one of our priorities was to have an infrastructure to pay for integrated behavioral health. And as value-based care and value-based contracting has increased, we have grown into this space a little bit, maybe just a little bit more than 0. But it is a hard and challenging growth process. And part of what we did was last year get together different payers and providers to talk about how do we actually really do this? How do we actually really make some changes? How do we work together? Because payers and providers might not always be the best of friends, just, no offense to either side. And there are challenges to understanding value-based care when it comes to understanding what the providers really need, understanding what the payers can really provide, and how do we overcome some of these barriers. So we brought these payers and providers together. We brought in new people to tell us about how they've used value-based care and contracting to support integrated behavioral health. So we had some presenters throughout the state and throughout the nation come talk to this group. Then we agreed upon some shared metrics that I think are still valuable metrics and will continue to be so for value-based care. Traditionally, metrics can be this long list of HEDIS measures for value-based care. And when payers engage with providers with a long list, it's hard for those providers to prioritize, like what is the most important, or what do we mostly care about with our patients. So we came up with 3 metrics that both payers and providers cared about, and that's preventable emergency room visits, potentially preventable emergency room visits, adherence to immunizations, and ADHD and follow-up care associated with ADHD and those HEDIS measures with those. Those are definitely of high value for our payers and for the state of Texas, because they give bonus dollars to our payers to meet these metrics and exceed these metrics. So just as a starting point, if you want to talk with a payer about some metrics, those are good ones to maybe start with. And then both before and after our learning community, we talked about shared needs. So what could our payers and providers agree upon are the needs, the things that need to advance to support value-based care and value-based contracting. If you can go to the next slide, Sujina. So we categorize these into 4 different areas, and these are areas that we didn't come up with a categorization on. Experts throughout the nation have created these, but we narrowed down under each of these the specific areas where support was needed. And so governance, board and executive leadership support. How many people here are a part of the board of directors of the organization they're representing today? Raise your hand, virtually or not. How many people here are on the executive leadership team of the organization you represent today? Oh, Bridget, very good. One. Yeah. We used to say when it came to integrated behavioral health, specifically, we had to get provider buy-in, right? It was like you have to have a provider champion, you have to get provider buy-in. Yes, provider buy-in is important. I don't think it's something that we have to dig deep for anymore. It's the leadership buy-in that we really have to dig deep for. And so we will talk about in our upcoming ECHO, the value and the specific steps that need to happen in order for value-based care to advance, and that's under governance, right? The second one is financing. No money, no mission, right? No money, no movement, no mission. And what a great way to get your executive leadership team on board is figuring out how to financially start and sustain value-based care contracting, because it takes financial investment. So that has to happen from the beginning. You have to have the right kind of health IT and data and analytics systems. So we're going to have people present on that. And then because we're the Integrated Healthcare Initiative, we're going to talk about the care delivery of integrated behavioral health as it supports value-based care and value-based contracting. So I'm going to hand it over to Sujina, and she's going to talk about the specific topics within our ECHO series that will touch on each of these.
Thank you, Kara. So these are the topics and some specifics around the dates. We will start off with introduction to value-based care and discuss its levels and sublevels. We will then expand to governance and leadership's role in value-based care, which will include engaging stakeholders and developing roles and essential skill sets. We will also have discussion around financial aspect of value-based care, such as contract negotiation, financial requirements, and data reporting, followed by care delivery, which will include team-based care, staffing, and efficient operations. We will also cover IT system and dashboard for the value-based care. So for all of these topics, we've put together some amazing presenters. They are known for their work in value-based care. We want to provide our participating organization with the support they need. So sometimes even after the ECHO session, we can connect you with these experts and they're able to provide their knowledge and resources and support that you may need in your in your value-based care journey. So first off, we have Daniel Chipping. He is the Director of Operations at Institute for Advancing Health Value, where he oversees research, membership, operations, and finance. He's been closely involved with strategy, the creation of the Health Value Atlas and corresponding assessments, and the development of other important industry resources through the convening of industry professionals for peer learning and collaboration. He also serves as the co-host of the Race to Value podcast and has interviewed more than 100 executives, physicians, entrepreneurs, and other leaders in the health value movement. So he'll be our first presenter, and we'll start off the series with introduction to value-based care and discuss its levels and sublevels. We've also put in the chat box the link to his podcast if anyone is interested. Victoria, please drop the link on the chat box when you can, please. Then we have Wayne Young. He is the Chief Executive Officer of the Harris Center for Mental Health, and he's the state designated local mental health authority and local intellectual and developmental disability authority for Harris County, Texas. And as the CEO of one of the largest behavioral health organizations in the nation, Wayne is passionate about the planning and delivery of a large-scale behavioral health and intellectual and developmental disability services to a population who rely upon safety net system of care. Under his leadership, Harris Center was recently recognized with an Excellence Award in Innovation by the National Council on Mental Wellness. Wayne previously served as the chair of the Texas Health and Human Services Commission Behavioral Health Advisory Council, and was recently appointed by the Supreme Court of Texas and Court of Criminal Appeals of Texas to the Texas Judicial Commission on Mental Health. He was honored with the Charlie H. Shannon Advocate for Justice Award from NAMI, Texas in 2019, as well as named in a modern healthcare list of top 25 innovators in 2019 and again in 2021. So he will be presenting on the roles and essential skills for governance and leadership in value-based care. And then next, we have Dr. Terry Sabella. Dr. Terry Sabella's expertise in quality improvement is actually recognized by the National Association of Healthcare Quality with certification as a certified professional in healthcare quality. Dr. Sabella's background has provided her with extensive knowledge of healthcare delivery and a keen understanding of the legal and regulatory framework in which organization must function. She'll be presenting on engaging stakeholders in governance and leadership's role in value-based care. Then we have Francois Debrantes. He has spent close to 2 decades working to transform the U.S. healthcare system in improving incentives for providers and consumers in order to encourage value-based decisions. As senior partner of the HCV Incentives Advisory Group, Francois leverages his decades of expertise to help providers, payers, and employer-focused organizations achieve their goal of achieving measurable changes in the system and improving outcomes for all Americans. So he'll be our presenter for financial requirements of finance and value-based care. Then we have Jennifer Mertz, who is an expert in healthcare transformation with more than 29 years of experience in clinical leadership spanning acute, ambulatory, specialty, and primary care setting. This background has provided her extensive knowledge of healthcare delivery with a quality and patient-centered focus. And as an innovative leader, she has implemented population health and care management model in adult, pediatrics, and women's health services, including behavioral health integration through a collaborative care approach. So her topic will focus on the care delivery and value-based care. We're also going to have a session finance and value-based care, specifically on data and reporting as well. The presenter for this session is yet to be determined. So with that, we're at the end of our info session. I'm just going to put up the QR code. You can scan this code if you wanted to register for this series. But in the meantime, if anybody has any questions, please feel free to unmute yourself or put in your question into the chat box.
After this session, you'll get a recording. And if your executive leadership team isn't here, I would highly recommend that you forward that recording to them, as well as the registration, because we really need those leaders in the organization to participate, particularly on the governance and financing pieces.
I don't think there are any questions. Well, then thank you all so much for joining. We hope to see you all in our series next month. Until then, take care.
Thanks, everybody.
Thank you.
Bye-bye.
Bye. Thanks, Dr. Crow.